Today we're going to talk about Chapter 6 and Diagnostic Agents. This chapter focuses on the different dyes in surgery to help visualization along with staining agents. We know that in surgery we need to be able to visualize the anatomy and the physiological function of the body. We have all heard how X-rays and imaging help diagnose and treat our patients. And now we have pharmacological agents that help us too, along with imaging. Contrast media. Many contrast medias have iodine and barium, which are radiopaque, meaning the substance does not allow the X-ray to pass through. Tumors and kidney stones become visible or opaque when using X-rays. We use contrast media a lot in vascular surgery, urology, and GI cases. You know when you are in those services to pay special attention to your patient's allergies. If your patient has a shellfish or iodine allergy and we are using contrast, we need to know that we have different solutions that we would need to use, called non-ionic media, meaning that the molecules in the solution do not break apart when dissolved in water. Our patients could suffer from anaphylaxis if this is not caught beforehand. Each service likes their own different media, so again, looking at the preference card under medications will help you remember. We always need to be careful when labeling because they are clear in color and could be mistaken for another medication on your field. You will need to keep track on your back table of how much contrast you use, and the surgeon will usually dilute the contrast 50-50. Common contrast medias. The first, high-paque, used in urology for cystoscopy cases for bladder or urethral stones. We inject the contrast through the patient's catheter and it will outline the location of the stone. Omnipaque is a non-ionic example where if someone has an iodine allergy, we would use Omnipaque. I would say it is the most commonly used because it is safer, and if someone has an unknown allergy, we are already eliminating the chances. This is also safe for intrathecal use. Intrathecal is the route of administration for drugs via an injection into the spinal cord or into the subarachnoid space so that it reaches the cerebrospinal fluid and is useful in spinal anesthesia, chemotherapy, or pain management applications. Visiopaque, another non-ionic media, and is the only contrast that has the same osmolarity as blood. Osmolar, which means induces less fluid shift from both red blood cells and endothelial cells than the lower osmolar contrast agents. The only difference from Visiopaque to Omnipaque is that it is not approved for intrathecal use. Dyes. Dyes are solutions that color or mask or mark tissue for identification. We use dyes to mark incision sites, to outline or trace normal tissue planes, and to help us enhance visualization of certain areas during the procedure. We can apply them topically, which means right on top of the skin, IV, or into a body cavity. For example, methylene blue is the most often used dye in urology and GYN. We mix the blue dye with normal saline. It is only about a 5 ml ampule, but it goes a long way when mixed with saline. If we ever nick the bladder or poke a hole in the bladder when we are sewing the vaginal cuff in a hysterectomy, for example, we can give the patient methylene blue through their catheter, and if we see blue inside the pelvis, we know there is a leak or tear. We also use methylene blue to see if a woman's fallopian tubes are patent. We call this chromointubation. We have cervical cannulas inside the uterus, and we hook up a 30 cc syringe with saline and methylene blue, and we inject. If we see blue inside the pelvis, they are patent. We use a laparoscope to see inside the patient, and if the tubes are blocked, then we would not see any blue dye. This is done if a patient is having trouble conceiving a baby or has pelvic inflammatory disease. Lymphozurin. Lymphozurin is used during breast node biopsies. This is injected off the field before prepping the patient, as it needs a 5-minute head start before we can make an incision to allow the medication to flow to the lymphatic system. The breast tumor will leak the blue dye, and the surgeon will follow the path to the sentinel node, which is then dissected and sent to pathology to see if the cancer has spread or not. If the nodes come back showing cancer, we do take more nodes. Indigo carmine. is given through the IV, which is also blue in color, to check for bladder integrity or kidney function. It cannot be metabolized by the liver, so we use this for rapid identification for leaks or damage to the ureters or bladder. Staining agents. We strictly use staining agents to help us visualize abnormal tissue cells. These staining agents will show a different reaction to abnormal cells than it should with normal cells. You will see more staining agents used when we start talking about gynecological cases. Lugol solution is a strong iodine mixture that is applied topically to the cervical os. It is really thick and sticky, so sometimes you have to use the back of your forceps to scrape it out of the vial from the circulator into your medicine cup. We have long cotton tip applicators we use to apply this solution. You can see these on page 89, letter D. The abnormal cells will not turn brown, so you can really see the outline here of the abnormal cells. Acetic acid, otherwise known as vinegar, is also used to identify cervical dysplasia, which is a precancerous condition in which abnormal cell growth occurs on the surface lining of the cervix. Your circulator will pour you some in your medicine cup on your back table, and again, using the large cotton tipped applicators, you dip the applicator into the acetic acid and hand it to the surgeon. This causes abnormal tissue to appear whiter than healthier tissue. Again, you can see this on page 89, letter B, the whiter abnormal cells.